well, we've had to adjust how we operate to ensure our programs and services can continue. And that means for many of us, we're working from a distance. That's also changed how doctors are helping patients. And that includes our own Dr. Terri Aldred. And she joins me today to talk about the importance of social or physical distancing and how programs like Zoom are helping to connect CSFS with the communities we serve. And hello.
Heidi, how are
Very
you?
well, hanging in there. I got my COVID haircut yesterday, actually, my pandemic haircut. So, yeah, things could be better.
Looks
Thank you.
good.
First question, I mean, how are things going so far for you? I mean, as a doctor during this crisis.
Entering week 7, I was actually doing a fellowship in women's health in the Lower Mainland. That was suddenly canceled, and so came back and joined the Carissa County efforts and to help ensure that patients still have connection. So Carissa County we're a little bit lucky in that we always did some telehealth as part of our primary care team. And so since most of us don't live in community, we didn't want to kind of bring anything into community. And so we moved to entirely virtual. And we were using telehealth machines usually in the health center. So people were still coming to their local health center to access even telehealth. And so since many health centers were either closed or had reduced access, we needed to find a different way to be able to connect with patients. And that's where Zoom had come in. With the Rural Coordination Center of BC, they gave free Zoom medical grade licenses out to all rural family physicians. And so we've been using that to connect virtually in people's homes.
And had you used Zoom before this all came about in your practice?
Not in my medical practice, no. I did have my own personal Zoom license for some of my provincial work and my medical education work to do kind of, to be able to do kind of group visits or group meetings where we could all see each other. And so that got upgraded to the medical grade option, which has like a virtual waiting room. So if and when people call in, I need to admit them so that multiple patients don't end up in the same meeting together.
Right. Now, I'm sure most people, I mean, up until this happened, I remember hearing about Zoom, but now it seems to be everywhere. But for those who have never used Zoom, what is Zoom exactly?
Yeah, so Zoom is it's kind of like a fancy form of FaceTime, really. So Zoom has the capacity to do video and audio connections, and up to like 500 people could be in the room, sometimes even more than that at any one time. And with the medical grade aspect of it, it's usually only one-on-one, and we can connect through a link to either your phone or to your email. And so there's lots of different forms. So like Messenger has this, and Google Duo, I think, has this capacity. And so Zoom made their marketing through mostly business. So it was intended for businesses so that they could hold virtual meetings mostly. And that's how I did it. So I did whole courses through Zoom virtually, and they have like ability to do breakout rooms and different things like that. And so that was kind of their market. The medical part of it, they kind of leaped into, and because Zoom is known to be quite user friendly, you can access it through like a click of a link. It was adopted to address some inequities in healthcare delivery through the province of BC for all providers. Right. It's not the only one being used, but it's one of the main ones right now.
A reminder for anyone who's watching this, if you have any questions for Dr. Aldred, you can post them in the comment section below, and then we'll answer your questions well, not me, she will. You don't want my answers as they come through. If I'm a patient who's never really used maybe might be afraid of technology. How are we preparing patients to, I guess, access Zoom so they could get into connection with you?
Yeah. So the MOAs, the medical office assistants, had drafted some guidelines on how to access Zoom. That they have sent out to the community health centers, and we're also priming people when you call to make appointments to talk about whether or not you want to like a virtual to be able to see me, or just a phone call, and different things kind of lead themselves better in either format. Certainly people who don't have great Wi-Fi or web connection, sometimes the just doing things over the phone works a little bit better. However, there's certain things, like if you're not feeling well, or if you have a pain somewhere, like your elbow hurts, you have a rash, things like that, it's usually better to be able to see the person, because we can get a lot just by having a visual of people. And so for those sorts of things, it would be better to be able to see people using Zoom. And so there's 3 different ways people can access it. So we can invite you through your phone. So we just enter your phone number. If you have the Zoom app downloaded onto your phone and it's available through wherever you get any kind of app, and it's free to download, then it will, as I call you in your phone, it will pop up in the Zoom app, and you can turn on your video and access it, and it'll give you an option to turn your microphone on, and then it'd be like a secure form of FaceTime. If you don't, or if you can't download it on your app, or for whatever reason, if I phone you, you can still pick up the call, and it would be like if I called you just regularly. The only catch is that the number comes up as New York, and when you answer it, you have an automated voice saying, "Would you like to join this call?" which could be a little disconcerting. So say yes, and then you'll still be able to talk to me. Yeah, say yes in this case. And then the other way is if you have a laptop or a computer, so you can download like a desktop app, but you don't need to. So if you want to download software, it usually just makes it a little bit easier. It's a little bit more streamlined. But if you don't want to download any software, we send you the link usually through the desktop or laptop is through your email. So if you'd like that option, then give us your email. We'll send you a link. You click on it, and it'll open up in another window. And at the very bottom, it'll say, if you don't have the Zoom app, click here, and it'll open in a web browser. So it'll be like a streaming form. And the nice thing about the Zoom licenses that the Carissa County doctors are using is that they are encrypted and secure. So none of and that just makes sure that like there's no recordings held anywhere in the world of the calls, anything like that. And because of the virtual waiting room, so even if people join a bit late, or multiple people are waiting to see me, I can choose who to admit, and then when we're finished, I can remove them from and enter the next one. So it just makes sure that people aren't coming in suddenly to other people's appointments and things like that.
I can imagine, especially with any new technology, especially when it first, as you said, a lot of this is probably we're figuring out as it's getting better and better, even the weeks that we use it. But people, it probably is that very real concern about privacy and using technology like Zoom.
Yeah, absolutely. And so, and Zoom themselves are trying to improve, and they will be updating their medical versions as we go forward to make it even better.
I have a question about, say, for example, I'm a patient, because even I know there are tips on how to best situate my camera, because I imagine though, when you're wanting to see something visibly, like a rash or whatever, is there things that people should know about their camera and how to kind of set it up? Or do you prefer using a mobile phone to kind of use Zoom so you can actually see? What's the best? As a doctor, what do you like to see from a patient and how they use this software?
Yeah, so certainly using like a laptop or a desktop, sometimes the camera can be a little bit higher quality. So for certain things that could be helpful. But certainly like if you have a rash on your foot, it makes it a little bit more challenging because then you're trying to do a weird yoga pose to try to show me your foot. And so that could be a little bit more challenging. And so depending on what it is, sometimes using a mobile phone with the app can be helpful because you can put it pretty much anywhere and kind of, for lack of a better word, zoom it in. So that we could hopefully get a better visual. The other thing is that some of the care aides and nurses are still doing home visits and things like that. And so sometimes they can help by, we can either connect with them through Zoom, or they can help set it up so that we can see you that way if you're having some if you're struggling or aren't super tech savvy.
Okay, that's good to know. And I imagine this has probably changed a lot for the better. I always think about like some of the changes that may become not permanent, but maybe change the way we do things in the future. What are some of the really kind of unexpected benefits of using things like Zoom as a doctor?
Yeah, well, I mean, a lot of people have said that, life as we know it in some ways probably will have ended, and this will kind of spark a new part of a different or new life. And part of the way that that's going to happen is that we're probably going to see virtual care being a lot more mainstream.
Why is it so important to maintain distancing despite, well, the overall numbers appearing relatively low to most people?
Yeah, so the social distancing, so the recommendation is to try to stay 2 meters to 6 feet away from people not in your household. And that right now we're in like the state of emergency, so we're in the highest restrictions. And so that does include like non-urgent medical visits, which is partly why not just so like a lot of the Carey County docs aren't doing outreach because, like I said, a lot of us coming from bigger centers going into communities, so we didn't want to bring in the virus potentially. But even doctors' offices in Prince George aren't seeing most of their patients in person right now. It's still mostly virtual, unless there's something urgent or time sensitive that needs to be done. And the reason for this is because the virus, so part of the thing around COVID-19 is that it's very infectious. So it actually spread super quickly. It spreads very easily through droplets. And the droplets don't necessarily just come from coughing and sneezing and things. It could just be from us talking. And it can survive on fabrics and on surfaces. And so when you are out and about, and if you're seeing lots of people or in your tight spaces, the chance of it being transmitted is very high. And so, so that's the rationale. And so by using Zoom, obviously there's that protection in that, I could cough right now into the camera and it's not going to affect you at all. And so, and so that's the rationale. And the nice thing is that what we're finding is that, it's really good to have the virtually enabled care where people that you have built-in relationships. So people that I have seen that I know. And so that way when I'm seeing them virtually, I can get a good or a better gestalt of differences than normal rather than using like a virtual walk-in clinic and that sort of thing.
Mm-hmm.
And it also would be helpful for people who may be in the future when the COVID-19's, maybe you're still somewhere with Wi-Fi, but maybe out, not in community, in town, but you still want to see a doctor, you could still make an appointment and potentially just be in your vehicle and pull up the app. And if there's something quick that you need, or maybe something you forgot about and you're in town and need a prescription or something like that. So there's lots of ways that it could be useful to help your care so that you don't have to spend hours in the future in a walk-in clinic or in emergency departments if you can easily connect in with your primary care team.
Yeah, I just recently fulfilled prescriptions over the phone. Like there's all these little things that we're doing differently now. And part of me is thinking, hey, like this is probably good for the system long term anyway. Because before I'd have to make an appointment, sit down, wait. but now it's done a lot quicker. So maybe, well, who knows, right?
Yeah, exactly. And I think again, the Harrison County team, we were lucky in that we were a bit more tech savvy to begin with because we did use it already.
Yeah.
But now lots of physicians are using it. Lots of pharmacists and pharmacies are doing like mail prescription orders and different things. And it does help to just provide people with choice and ability to access care when and how they'd like to.
Right. Are there any other tools that we're using right now with Zoom? Somewhat. Any other tools that we've had to adapt or use in the meantime as this crisis continues?
Like other platforms, do you mean, or?
Yeah. What have you found useful?
Yeah, so some people are using DoxyMe, which is pretty easy to use as well. And I think a lot of the urban doctors went that way through the divisions of family practice. And we're also looking at secure texting platforms to be able to kind of do that more one-on-one communication or like kind of instant communication that maybe doesn't need a phone call. And then there's also been a lot of specialty services that are coming up on virtual. So the FNHA has rolled out the virtual doctor of the day. And so if you have a question for the Harrison County communities on the weekend or something that comes up urgently on the weekend, you could call that number as well. Many of the Harrison County doctors are doctors, so you might end up talking to us anyway. And then there's also Rudy, and Rosie, which are just acronyms that I won't bore you with. But so if I see somebody and I'm worried about them, that there's something, maybe it's more of an emergency or, somebody's critically ill, I can actually call in to doctors who are do a lot of emergency medicine in rural communities, or even intensivists. So people who could help me manage critically ill people if needed. And there's also coming up to be a whole mental health and addictions virtual platform that's being developed through FNHA. Through Harrison County, a lot of our counselors in mental health are also doing virtual visits, and same with places like Foundry, Prince George for child and youth mental health. They're doing virtual counseling visits as well. So there's definitely lots of services available through virtual technology right now.
Right. It's wonderful. I was even looking like this. We're using what's called Be Live right now to do this Facebook Live. We just started using it as a means to interview people on Facebook Live, but just be able to see other people's face. I mean, that in itself provides some benefit, I think, during this time of physical distancing.
Absolutely.
Yeah.
And
so we can continue.
And just to that point, it's really important to try to find ways to connect with your loved ones and people that you don't share a household with during this time. And so whether or not that's calling them, texting them, or, even trying some of these, technologies where you could be able to see and interact, like me and my mom and her children, we've been doing weekly Zoom classes, weekly Zoom meetings, for lack of a better word. And it's just kind of interesting because when my brother and them aren't in town, we're not all together. And so it's really nice to be able to see everybody and go through how everybody's doing and things like that.
There's one of the other apps that I think we're trying. House Party is another one. People, I think it's the good old Google Hangouts or FaceTime. But yeah, there's lots of options out there. We do have a couple of questions here, and although I'll let people know that this conversation is mostly about physical distancing, how we use Zoom. We do have a couple questions, and I'm not sure. I'll ask them. If you can or can't answer, that's fine as well. Dr. Aldred, Ricky Newski, he's asking when we'll be getting the new test kits for COVID-19 in our area. And he writes, right now the results come back in 14 to 21 days. I'm not sure what the answer to that would be.
Yeah, so they are trying to speed up the testing. And so if the swabs and everything are labeled appropriately and such, they should come back actually within like 3 to 5 days. I know my swab came back about that time. again, I'm in Prince George, so that may have shifted things, but they are working on trying to get the tests that we have right now within that time. They are somewhat uncomfortable tests in that it's like a long Q-tip.
I was going to ask you.
It's and you have to so you put it through your nose, but it has to go as far back. It's weird because it's like the opposite. About right here. So it's like the halfway between your nose and your ear is kind of the goal. And I did my own swab, and it's uncomfortable. And so people are a little uneasy about that. And so, but there are, and I think this is maybe, Ricky, what you're alluding to, that there are a development, actually, it's a Canadian researcher that developed a technology to be able to do kind of more instant testing. And BC has bought in some, and I think 3 or so of those are scheduled to be housed within First Nations communities. But we're not quite there yet. So it's kind of coming down the pike, and hopefully we'll have those testings. And hopefully with the more instant, or what we call like ISTAT testing, like, for instance, I could test myself the day before I, say, go out to Notley or Saigas, and that way I know I don't have it, but could still start providing in-person care again with it. The testing guidelines have changed already, in that we're still only testing symptomatic people, but that's a really wide range of symptoms. So that's if you have a fever, cough, shortness of breath, nausea, diarrhea, like anything like that. It's healthcare workers who have symptoms, people who've traveled, and people in rural, remote communities, and people from Indigenous or First Nations communities. So that has widened from what it was before. And so we are able to start doing tests more readily in community and start testing a wider range of people. But right now we still just have the nose swab.
Right. And you actually answered Cynthia Williams' question as well. I think she was asking if members were getting any testing, and she had asked can we get a sealed test mailed or delivered to us. I don't know if I even want that at this point to do my own, like you mentioned, but yeah, it sounds like, yeah.
Nothing that's streamlined yet, but there are lots of those conversations. I know I'm part of a few provincial groups, and I know FNHA, the Rural Coordination Center, Northern Health are all looking at like how we can increase testing in remote rural communities, including Indigenous communities, and how we can do that in the safest way possible, meaning like how do we get swabs to you? How do we ensure you can take it safely? And again, part of that could be if you see me like this, I could probably walk you through how to take your own swab if you're up to that, or it would be working with our care aides and nurses and things like that. So those conversations are happening, and we'll hopefully have like a more streamlined process. Right now, almost all the testing in the regional areas are done through designated testing sites. And so in the Caris County communities, that would be Burns Lake, Fraser Lake, Vanderhoof, and Prince George at the urgent care center in Prince George. And so you do need a requisition. So you can't just show up and ask to be tested. So if you're having symptoms or you're concerned, do contact the Caris County MOAs and ask to speak to one of the docs on call, and to have that arranged if it's warranted.
Yeah. And this is kind of a similar question that was asked earlier this week, but I'll ask it. Cynthia asked after that, says, and I imagine this is fast moving because there's a lot of research being thrown into this right now. But she's asking, but are there tests to see if we've had the virus already?
Yes. So there is some antibody testing available. It's not being used readily at this point, only because some markers of tests that we use are called like specificity. I can't talk today.
Specificity. I got it.
And sensitivity. We don't really know like how, essentially how accurate they are. And we're actually unsure if you have the antibodies, if that means that you have immunity. Certainly once we can prove that, it would be really helpful, because if you've had it and you've developed immunity, then you could be somebody who could be out and maybe do the grocery shopping for your family and things like that, if you know that you already have immunity to the virus. Unfortunately, we're just the testing's just not, we don't know enough about it to be able to make those calls at this time.
And that's not the thing, though. Like, there's so much we don't know about this virus, and we just seem to be learning something new about the virus every week. And Philistine Olsen asked this very question: why they're saying now there's so many other symptoms? Is it because, again, there's so much we just don't know about it?
Yeah, exactly. I mean, when it's thinking about an emerging pathogen, generally we don't know. Like, so for instance, the flu, there's been lots of comparisons to the flu, and the flu in kind of its typical pattern, we kind of know how it works, and we know how it spreads, we know how it kind of acts, we know how to, identify it, and things like that. With COVID-19, we knew none of that. That's why the death rate has changed multiple times. How infectious or how rapidly it spread has changed multiple times, and also just how it presents. So now there's been findings coming out that people could have actually changes in their hands and feet, and there may be things like to check your nails and things. There's been a few case reports on that. So it is, as we acquire more information, that's why it changes all the time. Like right now I get 3 or 4 daily updates on things that they're learning. And so it is a lot to keep up to date, know how it's changed and shift. And part of the thing around the testing initially was that they were right now. The reason why they opened up the testing currently is that because community transmission seems to have slowed. It's really important to try to pick up new cases, whereas before. Really, it was all about containment, and so they weren't really focusing on testing a whole wide group of people unless it was highly likely that they had COVID. So they were really only testing people who were either highly likely or highly likely to spread it. So for instance, me. So that's why I was tested, because I had symptoms and I'm a healthcare worker. And so they wanted to make sure that if I had to see patients, I was for sure not going to be giving it to other people.
Right. Now, if anyone has any concerns, I always divert back to the numbers to call. If anyone has any concerns about having symptoms or would like to find out more information, what should they do?
Yeah, so if you have questions for sure about specifically COVID-19, then you can call the 811 line. I know that there have been concerns that are constantly busy, and so they've been working on opening that up. And I think trying to have physicians on the 811 as well. So you'll talk to a nurse first, and if they feel like you need to talk to a physician, they will have that. They won't provide any treatment advice or anything like that, but it'd be mostly to say whether or not you should get tested or go to emergency or that sort of thing. And certainly during the week, Monday to Friday, if you'd like to connect with one of the Terri County docs, you can either call your local health center or the Prince George main office at 250-562-3591, and they can put you in touch with the doc. There's usually more than one of us on every day right now, and so you can get in to see somebody in the same day, and if there's a specific doctor you'd like to talk to, you can definitely see them within the week.
And that'd be obviously the way likely to set up a Zoom meeting if at all needed as well.
Yes, exactly. And there is a Northern Health 1-800 I think number, but I actually don't know if I know it.
Well, we can post it in the comments after below, so people would like to see. We'll make sure we post that as well. And if anyone has any other questions for us, other doctors, for Terri County, they can email communications at csfs.org. And I always like to leave these things with, if you have any final thoughts, suggestions to share with Dr. Aldred, we'd love to hear it. Anything else?
No, other than that, it's getting to the 7 week mark, so I get that people are starting to get a little bit cabin fever, maybe, and so it's just really important to try to honor your feelings, but kind of just hunker down and keep with it, keep with the social distancing, keep with the hand washing. The fact that we're lowering transmission and flattening the curve is proof that this is working. And just to remind that, I know this seems like this is life changing, and I know it's seems like it's mysterious and coming out of nowhere, but really plagues are as old as man. And so the fact that we've managed to go almost 100 years without something globally to the scale is actually a miracle in and of itself. And so, just keep that in mind and be safe and connect with one another. And I hope to see you all soon.
We will get through this. And that Northern Health COVID-19 helpline, 1-844-645-7811. Dr. Aldred, thank you so much for joining me today.
Thank you. Take care.
And Musicho, everybody.